Welcome to the Maricopa Community College's Health and Safety Training course. Here, we'll provide you with basic information about the health and safety requirements for all Maricopa community colleges participating in clinical education. These preclinical requirements are in place to provide protection to both the students and patients. In this video, we'll review your immunization requirements, CPR certification requirements, how to obtain your DPS Level 1 fingerprint clearance card, completing healthcare provider document, urine drug screenings, and background screening. So let's get started. Immunizations are a key part of the process. These are 3 examples of valid immunization records. The first immunization required is the MMR vaccine. MMR is a combined vaccine that protects against 3 separate serious illnesses: measles, mumps, and rubella, also known as German measles, in a single injection. The full series of MMR vaccination requires 2 doses. If you've had all 3 illnesses or you have received the vaccinations but have no documented proof, you can have an MMR IgG titer drawn and upload a copy of the positive lab results for all 3 diseases.
If you do not have documented proof of MMR series and have a negative titer drawn result, you will be required to complete the full MMR series.
To meet the MMR requirements, submit documentation of 2 MMR vaccinations on separate dates at least 4 weeks apart, lab documentation of positive titer results for measles, mumps, and rubella. This is an example of acceptable documentation. The next immunization needed is varicella. Varicella, or chickenpox, is a highly contagious disease caused by the varicella zoster virus, VZV. Infection with chickenpox also makes people susceptible to develop herpes zoster or shingles later in life. A varicella vaccination is required for all healthcare workers who don't meet evidence of immunity by having met any of the following criteria: documentation of receiving 2 doses of varicella vaccine, separated by at least 4 weeks, or laboratory evidence of immunity or confirmation of disease.
If you do not have documented proof of varicella series and have a negative titer drawn result, you will be required to complete the full varicella series. To meet varicella requirements, submit documentation of 2 varicella vaccinations on separate dates at least 4 weeks apart, or lab documentation of positive titer results for varicella. If you haven't had the varicella vaccine, or if you don't have the blood test that shows you are immune to varicella, upload documentation of 1 varicella booster dated after negative or equivocal titer. The Tdap vaccination can protect against tetanus, diphtheria, and pertussis. These are serious bacterial illnesses which can lead to severe sickness and death. This vaccine is recommended for healthcare personnel with direct patient contact and can help prevent them from spreading pertussis to their patients. Following administration of Tdap, a TD booster should be given if 10 years or more since the Tdap. Tdap may be given as one of these boosters if you have never gotten it before and can be administered regardless of interval since the previous TD dose. To meet the Tdap requirements, submit documentation of a Tdap vaccination administered after the age of 11, and then a TD vaccination every 10 years thereafter. The 4th immunization required is tuberculosis. Tuberculosis, or TB, is caused by a bacterium called Mycobacterium tuberculosis, which usually infects the lungs but can attack any part of the body, such as the kidney, spine, and brain. Not everyone infected with TB bacteria develops tuberculosis. As a result, 2 TB-related conditions exist: latent TB infection and TB disease. If not treated properly, TB disease can be fatal. To meet the tuberculosis requirements, submit documentation of a negative 2-step TBST consisting of an initial TBST and a boosted TBST 1 to 3 weeks later, completed within the previous 6 months, including date given, date read, result, and name and signature of the healthcare provider. Past negative 2-step with each subsequent annual 1-step test,
annual tests must be administered 10 to 12 months apart, is acceptable. If more than 12 months has passed between tests, a new two-step TB skin test will be required, or a negative blood test, quantiferin or T-spot, performed within the last 6 months, and a negative chest X-ray if TBST or blood testing is positive. If you have a positive TBST, provide documentation of a negative chest X-ray within the previous 6 months, or negative blood test and a completed Allied Health and Maricopa nursing questionnaire. The tuberculosis screening has 4 parts. On your first visit, you'll receive a TB shot, and a healthcare provider will document it on a 2-step testing form that is available in your immunization tracker. Make an appointment 48 to 72 hours later for a second visit. On visit 2, a healthcare provider will evaluate the reaction or lack of reaction from the shot you received on the first visit and document it on your form. Make an appointment 8 to 21 days later. If over 21 days, the processes must be repeated. Visit 3 is a repeat of Visit 1. Make an appointment 48 to 72 hours later. On the final visit, a healthcare provider will evaluate and document the final shot. This is an example of the document to be completed. Students may be exposed to potentially infectious materials, which can increase their risk of acquiring a hepatitis B virus infection. Hepatitis B is a serious disease that can cause acute or chronic liver disease, which can lead to a serious, lifelong illness. Maricopa Community College's healthcare education recommends that all students receive the Hepatitis B 3 vaccine series administered over a 6-month period. Obtain the first vaccination. The second is given 1 to 2 months after the first dose, and the third injection is 4 to 6 months after the first dose.
To meet the hepatitis B requirements, submit your immunization record showing completion of the 3 hepatitis B injections.
If the series is in progress, upload a copy of the immunizations received to date and remain on schedule for the remaining immunizations. 1 to 2 months after your last immunization, it is recommended that you have an HBs-AB titer drawn,
or submit documentation of a positive HBs-AB titer or a copy of your signed hepatitis B declination, noting that by declining the vaccine, you continue to be at risk of acquiring hepatitis B.
The single best way to protect against the flu is an annual vaccination. Influenza is a serious contagious respiratory disease which can result in mild to severe illness. Susceptible individuals are at high risk for serious flu complications which may lead to hospitalization or death. A flu vaccine is needed every season because the body's immune response from vaccination declines over time, and flu viruses are constantly changing, so the formulation of the flu vaccine is reviewed each year and sometimes updated to keep up with changing flu viruses. The seasonal flu vaccine protects against the influenza viruses that research indicates will be most common during the upcoming season. To meet the influenza requirements, submit documentation of a flu vaccine annually. To recap, the following vaccinations are needed to meet the immunization requirements: MMR, varicella, tetanus, diphtheria, pertussis, or Tdap, tuberculosis, hepatitis B, and influenza. The next area we'll review is the CPR requirement. CPR is a procedure performed on persons in cardiac arrest in an effort to maintain blood circulation and to preserve brain function. Students are required to learn CPR by completing an acceptable basic life support course. This certification must include infant, child, and adult patients. 1-man and 2-man rescuer, and evidence of a hands-on skills component. CPR courses are offered at numerous locations throughout the greater Phoenix area. To meet the CPR requirements, upload a copy of your signed CPR card front and back or CPR certificate and maintain status throughout enrollment. The third topic is the Level 1 fingerprint clearance card. All students admitted to any Allied Health or Maricopa nursing program are required to obtain and maintain a valid Level 1 Arizona Department of Public Safety fingerprint clearance card, or FCC. The FCC must remain current throughout every semester of enrollment in the program. Costs $65 plus the cost of fingerprinting and is valid for 6 years. If the FCC is suspended or revoked at any time during the program, the student must report this to the program director within 5 school days and will be unable to continue in the program until the FCC is reinstated. To meet the FCC requirement, a copy front and back of a current Level 1 DPS fingerprint clearance card will be obtained by the program. Another requirement is a healthcare provider document. A physical exam is required to all allied health and nursing students. This exam indicates that a student is able to meet the physical and mental requirements for students in the health sciences. To meet the healthcare provider document requirement, when requested by the program, students must provide a signed copy of the healthcare provider document within the past 6 months. If a student has any restrictions, such as weight-bearing limits, or requires the use of an appliance, such as an orthopedic boot, sling, or other assistive devices, the student must discuss with the program director prior to uploading the final health and safety document. Failure to discuss and clarify the restriction prior to entering the program may result in the inability to complete the clinical portion of the program. This is an example of the document to be completed. All healthcare students are required when requested by the program to submit a pre-clinical urine drug screen. Students will receive instructions from the authorized contracted laboratory to perform the test. The drug screen is completed at the student's expense. No previous drug screenings will be accepted. Urine drug screens are required of students prior to attending courses. Medical marijuana or its metabolite is not an acceptable substance in urine drug screens and will result in a positive urine drug screen. Students with a prescription for medical marijuana would not be considered exempt from urine drug screening. To meet the drug screening requirements, a student must complete within the designated time frame a negative specimen. The last requirement is the background screening. Students are required to show a pass result on the MCCCD required supplemental background screening, completed within the past 6 months, to meet the requirement. When requested by the program, a student must use the school-specific package code, complete and pass within the previous 6 months. If you do not pass the background screening, please contact an advisor at your campus for information regarding a self-assessment. Thank you for completing the Maricopa Community College's Health and Safety Training course.